to all of you. My name is Hara Tziouvara, and I'm the president of Doctors of the World Greece, or as others might call us, Médecins du Monde class. I'm a pediatrician neonatologist, board member since 8 years, and voluntarily since 2011. It's a great honor for me to be here among you, invited by the Hellenic Initiative Canada. But I must admit it's also very emotional, since I was born and raised here in Montreal from Greeks who migrated in the late 60s, hoping for a better life here, just like most of your families did. And it's even more emotional that even though all of you probably have very good lives here, you never forget your origin, and mostly you're always concerned how to help Greek communities and organizations. And this is the real Greek spirit and the philogeny. Since the Greek economic crisis started years ago, there was a tsunami of dramatic socio-financial changes. As a result, middle-class salaries and life as we knew it does not exist anymore. And this is not a political point of view, this is a humanitarian point of view. As Indian Greece, we observed that we had to face a new reality in our country, so we had to come up with domestic projects for the destitute and unemployed citizens. So, who we are. 1980, Médecins du Monde establishment in France. 1990, establishment of Médecins du Monde Greece. We're with international missions and domestic missions. Our goal. We're a non-profit organization, and health is a basic human right for everyone without discriminations. Our services: primary health care, psychosocial support, medicines and essentials, accommodation. Our programs are open polyclinics. We have 6 open polyclinics, 1 health desk and 2 social clinics. And during 2018, we consulted 8,500 approximately pediatric departments and consulted overall 58,000 people. Our accommodation facilities: we have the night shelter for the homeless. We hosted only during 2018 about 300 people, and also the structure for the medium-term accommodation of women at risk. We have the mobile medical units, the Athens Road Project, which deals mostly with people at risk, emergencies at night, and the project Health for Everyone, mobile units going all around Greece with pediatrician, gynecologist, ophthalmologist, and dentist. Also, we're available for crisis management with the mobile medical units in refugees hotspots. I must tell you that I was probably the first pediatrician in Hara Tziouvara, Lesbos, when all the refugees started coming in from Turkey. We also have a polyclinic for vulnerable third country citizens, and also we're intervening in Rafina for the fire victims, because as you all know, last year we had a terrible tragedy, a fire tragedy in Athens. So, with the THI Canada, what can I say? Thank you, thank you, thank you. 2018, this was our first year together. We supported our open polyclinics in Athens, Patra, and Haina. Consultations, medical consultations, vaccinations, medicines, providing medicines, and also medical consumables. So as you see, medical consultations, we had 30,000 people coming in our offices in Athens, Patra, and Haina. And also medicines and vaccinations, we provided about 9,000 of them. This year, you're also with us, 2019, supporting the dental office of Médecins du Monde in Athens with dentists, nurses, and medical consumables. I have to say that dental care in Greece is exclusively or almost exclusively private. This means that with the economic crisis, middle-class Greek families can't afford paying a dentist, since with the increase of taxes, even the medical supplies are more expensive. The result is that dental care has become less of a priority for a big part of the Greek population. Things are even more difficult for the people in need, meaning people with no social insurance. We have almost 3 million Greek people at this minute. Homeless people, single-parent families, non-specialized workers, economic migrants, refugees, and of course children. So this population cannot respond financially to dental care and hygiene. So absence from the dentist increased at a high percentage, while based on Reuters and Hellenic Dental Association, Greek children are amongst those with the worst dental hygiene in Europe. Based on Elstat, which is the Greek Statistics Service, in 2009, Greek families spent an average of 470 euros annually for dental care, but now the average amount is about 90 to 120 euros annually. This program also focuses mostly on the dental care of the people who are hosted at our shelter for the homeless people. Our needs. The structure for the medium-term accommodation of women and children at risk. So on March 1st, 2019, this year, Médecins du Monde opened the gates of a new structure relying solely on their own strength, and they offered their staff and volunteers. Between April 2018 and February 2019, 50% of the total of the people hosted in our shelter for the homeless were women. Practically, the structures available for women in need are very few, mostly for domestic violence cases. Even in these cases, there is serious time delay for their accommodation. But there are also women who lost their houses because of their debts, unemployment, separation, and for other reasons as well. For these women, the only available solution right now in Athens is there's just one public hosting shelter, and just one, and our MDM shelter for the homeless providing 7 beds for these women. So instead of subcategorizing all these women based on the reason they're homeless, on their age, or whether they have children or not, we find it of major importance to establish a shelter exclusively and only for women with a holistic approach of the project, providing shelter and hosting for single women or with children and making sure they're not left in the street. Empowerment, encouragement, and psychosocial support, making sure they can cope with a new reality in their lives. Social integration through our MDM services, and also follow-up and aftercare services, which lasts about 12 months. The hospitality shelter for women in need is already in operation next to our polyclinics in Athens, which is in the center of Athens practically, and it's next to all the services we need, so we can practically, it's practical for us to evaluate and monitor effectively the outcomes of our project. It's a 24-room establishment. So essentially, we have the establishment, we have the experience, and the proper collaborations for an effective approach of the project. But most important, and we all know it, we need human and financial resources to make this work the right way. At MDM Greece, we rely on the people to help the people through donations and funding. Responding to the ever-increasing need for the accommodation of women who do not fit in the usual accommodation centers, which mainly focus on the issue of abuse. For instance, unemployed mothers with children, elderly who have been evicted from their homes, etc. In the case of abuse, emergency coverage, directly accommodating the woman at risk until her introduction to the appropriate facility for victims of domestic violence. So how can I help? By donating, by volunteering, by sharing our news, making our work known, and by offering moral support, knowing that you have the same concerns as we do. Our communication through the website mdmgreece.gr, Facebook, Twitter, Instagram, and our telephone in Athens. I would like to thank the Hellenic Initiative Canada for inviting us here. I'd like to thank Mr. Sotos and Mr. Georgiadis, Mrs. Adonopoulou and Mr. Retsinas, and Mrs. Bukovala for the communication. Σας ευχαριστώ πάρα πολύ.